everyone, and welcome to Module 2. This week, our focus is on eyes, which is ophthalmology. And you have two chapters that we're looking at this week. Chapter 26, pages 586 to 586 to 593. And chapter 39, pages 886 to 895. So let's go ahead and take a look at each of those in a little bit more depth and detail. So we're going to start with talking about chapter 26, which is going to help us understand the structure of the eye. And it's also going to talk about diseases associated with the eye. So the eye is a spherical shaped, fluid-filled organ that is composed of structures that facilitate vision. Those structures are your cornea, pupil, lens, and retina. The nervous system plays a very large role in your sense of vision. The nerves of your eye help to control the amount of light that enters the eye through the pupil. It helps to focus the light on the retina by using your lenses, and it helps to transmit the resulting image from your retina to your brain. So now let's actually focus on and talk about the structure of your eye itself. So the eyeball itself is housed in the cavity of your skull called your orbit. The eye is divided into two cavities, the front and the back. The surface of your eye is made up of three layers: the outer layer, or the sclera, the middle layer, which also includes your cricoid, iris, lens, and cellular body, and your inner layer, or the retina. Beyond the eye, there are external structures that are associated with your eye. They have your eyelid, your conjunctiva, your limacral apparatus, and the extringent eye muscles. Your eyelid is what actually closes over the eyeball, and it protects the eye from intense light, foreign matters, and impacts. Your conjunctiva is a mucous membrane that lines the underside of your eye and the anterior part of your eyeball. And the lacrimal apparatus is where your tears are produced, stored, and removed. So now that we understand the structure of your eye, the parts of your eye, and what system helps to include your vision, what we need to really talk about are some of the common eye disorders. First, we have an astigmatism, and this is a condition caused by an irregularity in the curvature of your cornea or lens. It's characterized by blurry vision, and it can also cause squinting and headaches. It's generally treated with glasses, contacts, or surgery to reshape your cornea. You have cross eye or wall eye. This is where a patient has a disorder that may have problems with depth perception and double vision. The treatment will include glasses or contacts, wearing a patch over the stronger eye to force the weaker one to become stronger, and surgery. Myopia is also what we call nearsightedness, meaning that the patient has difficulty seeing items far away. This can be treated with glasses or contacts, or potentially even surgery, depending on the amount of the disease that has taken place. Hyperopia is also what we call farsightedness, meaning that the patient has a difficult time seeing things close up. This can be treated with corrective lenses. And then lastly, we have presbyopia. This is similar to farsightedness, but it's actually directly related to the aging process, meaning that a patient has lost the elasticity in their eyes and in their eye muscles, which has caused them to have farsightedness as they have gotten older. All right, so that's where I'm going to stop for chapter 26. We're going to now move on to chapter 39, which which is really dealing with ophthalmology itself and the study and the care of the eye. This branch of medicine deals with the structure, function, diseases of the eye, and it's all called ophthalmology. The ophthalmologist is a medical doctor who can perform exams, surgery, and they can even prescribe medications, glasses, or contacts. An optometrist, however, is a technician who specializes in the grinding of lenses and preparing glasses or contacts, meaning they cannot prescribe anything. You have to see an ophthalmologist for that. There are a number of eye exams that can diagnose and treat vision problems. Most can happen in your primary care office during what we would consider a routine screening. When doing a vision exam, the provider will look at the patient's pupils, as well as the eye itself. When we are talking about the eye and eye exams, we use an acronym called PERLA. That's P-E-R-R-L-A. That stands for pupils equal, round, reactive to light, and accommodations. Some other abbreviations that you might hear of are OD, which is right eye, OS, which is left eye, and OU, which is both eyes. Now, when doing an exam, medical assistants will provide visual acuity or clarity of vision. Normal vision is typically what we consider 20/20, but that's just normal. It doesn't mean that it's the best vision possible. As the medical assistant, you will be responsible for assessing visual acuity, such as distance acuity, near vision acuity, and color acuity. So let's go ahead and take a look at each of those and describe them a little bit further. Distance acuity is measured using what we call a Snellen chart. The chart is placed with the largest symbols at the top line, and each line after is decreasing in size. The patient will stand about 20 feet away and read each line as they can. The results the patient will receive is based on the last line that they can read without any squinting or mistakes. And it will be recorded as a fraction. For example, if we had a patient who reads 20/60, that means that the patient can read at 20 feet what other patients could read at 60 feet. Likewise, if we had a patient who read 20/30, they would read at 20 feet what others would see at 30. We also have our near vision acuity, which is done when a patient's having problems reading or performing tasks up close. This type of test is done using what we call as a Jaeger chart. The patient will read the card held at a normal reading distance away, usually 14 to 16 inches. The card has a series of paragraphs decreasing in size. The patient's result will be read as the number above the last paragraph that they can read easily, again, without any squinting or errors. The last one that we have that we need to talk about is color vision acuity. This test will be used to determine the inability or to distinctly differentiate between colors of the spectrum. Defects in color vision are either from birth, or being born with it, or they're inherited, or they're acquired through certain diseases or injuries. Typically, this test will use what we call an Ishihara test. It's a printed card or book with single color dot illustration containing a number, curved line, or shape. You will show the patient 14 cards, and in order for them to have normal vision acuity with color, they need to be able to read at least 10 of them without any errors. More often than not, color blindness is more prevalent in males than females. Now, along with doing the visual acuity testing, medical assistants may also be responsible for performing irrigations of the eye or installing eye medications. When irrigating the eye, this is where you will rinse out the patient's eye to remove any foreign substances or chemicals. This requires the use of a sterile technique and equipment that you have, sterile equipment and technique. You'll have the patient sit or lie down if it's easier for them laying down. I actually think that this procedure is easier to do if the patient is laying down. Tilting their head to the affected side so that it is downwards. You will open the patient's eye with your thumb and index finger with your non-dominant hand. You will then use a syringe with sterile water to irrigate the eye. You'll continue this method until the solution is used up or the object has been removed. You may also have to install eye medications. This is something that as a medical assistant you may have to instruct the patient how to do for themselves or actually put that first dose in. This will be similar to an eye irrigation of a patient. They will sit with their head tilted back and looking up. The medical assistant will pull the eyelid down, hold the dropper about a half an inch above the eye, and apply the recommended amount of drops or ointment as prescribed. Once it is inside the eye, you'll want to let go of the patient's eyelids so they can blink. This will allow the medication to work through the entire eye. Alright, so this is where I'm going to stop for my review of chapters 26 and 39. You will have to make sure that you do read your chapters this week, as it will help prepare you for your discussion board, but also for your lab classes, because you want to be prepared when you go in for those this week. So for your homework this week, first thing is there is no quiz this week. There's only a discussion board. For your discussion post this week, you are looking at and discussing the topic of 20/20 vision. You'll need to do some research and discuss if 20/20 is the best vision possible. You will also need to discuss if it's bad if a patient or a person cannot see or does not have 20/20 vision. Your initial discussion post will be due Tuesday, July 11th by midnight, and you'll need to respond to at least one classmate no later than Saturday, July 15th by midnight. Again, remember that replies to the instructor do not count for your grade, so in order to get the best grade possible, please make sure that you're making that one reply post to a classmate no later than Saturday, July 15th. As always, please make sure that you're reading the discussion board rubric, so that way you are hitting all of the topic points in order to get the best grade possible. Alright guys, that is all I have for week 2. If you do have any questions, comments, or concerns, please make sure that you are reaching out to me, either via Blackboard email for our course, or you can call me directly at the Rockford campus, and you can find my direct line on our course homepage up to the right-hand side where you actually see my picture as well. I hope you all have a great week too, and let me know if you have any questions. Bye-bye, guys.